Instantly clear sinus congestion and stuffy nose with this simple technique. Understanding sinus congestion and nasal blockages. Sinus congestion and a stuffy nose can be incredibly frustrating and debilitating. Whether it's caused by a cold, allergies, or chronic sinus issues, the feeling of being unable to breathe freely through your nose can be miserable. Sinus problems are extremely common, affecting millions of people worldwide. The good news is that there are effective ways to find relief. The sinus cavities, also known as the paranasal sinuses, are a series of air-filled spaces located around the nose and eyes. There are 4 main sinus cavities: ethmoid sinuses, located between the eyes; maxillary sinuses, located behind the cheekbones; frontal sinuses, located above the eyes in the forehead; sphenoid sinuses, located deep in the skull, behind the eyes. When these sinus cavities become inflamed or blocked, it can lead to a range of unpleasant symptoms, including nasal congestion and stuffiness, facial pain and pressure, headaches, difficulty breathing through the nose, reduced sense of smell and taste, post-nasal drip, coughing and throat clearing. Sinus issues can be caused by a variety of factors, including viral or bacterial infections, allergies, structural abnormalities, and environmental irritants. Regardless of the underlying cause, finding effective relief is crucial for maintaining overall health and well-being. The eustachian tube connection. One important factor in sinus and nasal congestion is the eustachian tubes. The eustachian tubes are small passageways that connect the middle ear to the back of the throat. When these tubes become blocked or swollen, it can lead to a range of ear-related symptoms, including ear pain or pressure, ringing in the ears, tinnitus, dizziness or vertigo, muffled hearing. The eustachian tubes are closely connected to the sinus and nasal passages, so issues with one can often affect the other. When the eustachian tubes are blocked, it can contribute to sinus congestion and a stuffy nose. Conversely, sinus problems can also cause the eustachian tubes to become blocked, leading to ear-related symptoms. A simple technique to instantly clear sinus congestion. Fortunately, there is a simple and effective technique that can help clear sinus congestion and open up a stuffy nose in a matter of seconds. This technique, developed by Dr. Alan Mandell, targets the key areas that are involved in sinus and nasal blockages. Step 1. Stimulate the zygomatic bone. The first step is to stimulate the zygomatic bone, which is the cheekbone. To do this, first, place your right thumb underneath the cheekbone on the left side of your face. Gently push the thumb in and out, creating a massaging motion. Step 2. Tug on the earlobe. While continuing to massage the cheekbone with your right thumb, use your left hand to grasp the lower part of your left ear and pull it straight out, holding for 10 seconds. This action helps to open up the eustachian tubes, which are connected to the sinus and nasal passages. By stimulating the earlobe, you're creating a reflex that can help relieve sinus and ear-related symptoms. Step 3. Repeat on the other side. Repeat the same process on the other side of your face. Place your left thumb underneath the right cheekbone and push in and out. Use your right hand to grasp the lower part of your right ear and pull it straight out, holding for 10 seconds. Step 4. Activate the nasal reflex. The final step in this technique is to activate a reflex that can help open up the nasal passages. Use your fingers to gently squeeze your nose, closing off the nostrils. Take a deep breath in through your mouth. Hold your breath and tilt your head back as far as is comfortable. Hold the breath for as long as you can, then release your nose and exhale. This sequence of deep breathing and head tilting creates a reflex that can help stimulate the sinus and nasal areas, leading to increased drainage and reduced congestion. The science behind the technique. This simple technique works by targeting several key anatomical structures and physiological processes that are involved in sinus and nasal congestion, stimulating the zygomatic bone. The zygomatic bone, or cheekbone, is closely connected to the maxillary sinuses, which are a common source of sinus issues. By massaging this area, you're helping to stimulate and open up the sinus cavities, which can improve drainage and reduce feelings of pressure or pain manipulating the eustachian tubes. The eustachian tubes play a crucial role in sinus and nasal function, as they connect the middle ear to the back of the throat. By pulling on the earlobes, you're creating a reflex that can help open up and decongest the eustachian tubes, which in turn can improve sinus drainage and reduce feelings of stuffiness or pressure. The deep breathing and head tilting. Activating the nasal reflex. The deep breathing and head tilting sequence in the final step of the technique activates a specific reflex that can help open up the nasal passages. This reflex is believed to be mediated by the trigeminal nerve, which is responsible for sensations in the face and head. By temporarily closing off the nostrils and holding the breath, you're triggering a response that can lead to increased nasal airflow and reduced congestion, putting the technique into practice. This simple three-step technique can be performed anywhere, anytime you're experiencing sinus or nasal congestion. It's important to note that while this technique can provide immediate relief, it's not a long-term solution for chronic sinus issues. If you're dealing with persistent or recurring sinus problems, it's best to consult with a healthcare professional to address the underlying cause. That being said, this technique can be a valuable tool in your arsenal for managing sinus and nasal symptoms. Here are some tips for getting the most out of this technique. Practice the technique regularly, even when you're not experiencing congestion, to help maintain healthy sinus and nasal function. Pay attention to how your body responds and make adjustments as needed. For example, you may need to apply more or less pressure when massaging the cheekbone. Combine this technique with other sinus-relieving strategies, such as using a saline nasal spray, staying hydrated, and avoiding irritants that can trigger sinus issues. Share this technique with friends and family members who may also be struggling with sinus or nasal problems. It's a simple, drug-free way to find relief. Remember, the key to success with this technique is consistency and patience. It may take a few tries to get the hang of it, but once you do, you'll have a powerful tool at your fingertips to help you breathe easier and feel better. Conclusion. Sinus congestion and a stuffy nose can be incredibly frustrating, but there are effective ways to find relief. This simple three-step technique developed by Dr. Mandell targets the key areas involved in sinus and nasal blockages, helping to instantly clear congestion and open up the airways. By stimulating the zygomatic bone, manipulating the eustachian tubes, and activating a nasal reflex, you can experience immediate improvements in your ability to breathe freely. While this technique is not a long-term solution for chronic sinus issues, it can be a valuable tool in your arsenal for managing sinus and nasal symptoms. Remember to practice this technique regularly, even when you're not experiencing congestion, and to combine it with other sinus-relieving strategies. With a little bit of practice, you'll be able to breathe easier and feel better in no time. So give it a try and see the difference it can make for you. For more information and resources on sinus health and wellness, be sure to check out the Motivational Doc website and Facebook page. And don't forget to subscribe to the YouTube channel to stay up to date on the latest health and wellness tips from Dr. Mandell.